So I was originally referred to MB2 from a good friend, Justin Crockett, that joined, I believe, in 2014. I was familiar with who he was doing, but at the time it wasn't quite as organized as what it has become now. But we've talked through the years, and last year we attended the DSO meeting, Henry Schein, and was able to meet all of the doctors that are part of MB2, and really got along good with them and kind of started the relationship there. Our partnership is very unique as there's 4 partners, but the age difference is spread about 16, 17 years from the oldest to the youngest. And so we were concerned about the transition of the older doctors and the continuity with the younger doctors still going in, because everybody was producing different. And so MB2 with the partnership still allowed us to maintain our control of the practice and our growth, but we're partnered to ensure that the practice itself is going to exist for years beyond as the older founding dentists leave. The mid-market, like Amarillo, Texas, is so different from the larger cities. I'm not sure I could ever survive in a larger city because the competition isn't quite there, and you base yourself more on reputation than you do on your marketing ability and being seen. So it's being known more in the public. For people that don't even go to you, they know who you are because there's not as many dentists. You really have to maintain that relationship and maintain your reputation more, I believe, in a smaller mid-market town than you do in a bigger city, which I hope we've done very good. And we've expanded into different locations based on the growth of the city, so our locations have followed the growth, and so we find ourselves moving in 3 directions right now, maybe a 4th in the future. So some advice for dental students just coming out is to don't look at the coolest place with the nicest river or the nicest downtown going out places, because everybody wants to be there. You need to look around at need and want. When I came to Amarillo, I was the only dentist that came that year, and it's really been like that. You can travel anywhere, but you need to know that you're going to be working most of the time, 4 or 5 days a week, and you want to go somewhere that needs you, not somewhere that you want to go. Because when you go somewhere that you want to go because it's cool, you've got to know that so does everybody else that's graduating dental school. So be very smart in your decision, and don't overlook the mid-markets and the smaller markets the way the saturation is going now. And I think that it will be you'll make a lot more money doing it. So a big thing in our practice is patient care and always having something unique to do. In fact, I paint all the paintings that I keep in my operatories, and I try to change them out about every 6 months, depending on when I have time to do it. It helps me relax, but it also is a conversation piece for the patient when they come in. They don't want to talk about dentistry; they want to talk about something else. So you're like, "Do you like my art?" If you don't, it's no big deal, but I did it. So then it kind of starts a conversation. But I think everybody has to find an outlet or something that they want to do outside of the dentistry that they enjoy, that gives them some kind of creative control over the life. So.